Hello and welcome to the Concentra webinar, OSHA Recordable Injuries. Today's webinar will be presented by Dr. Janet Cobb and Jim Waugh, physical therapist. Dr. Cobb is a Concentra Director of Medical Operations, has more than 20 years of experience in occupational medicine, and is board certified in internal medicine. Jim is a Concentra Director of Physical Therapy, has more than 15 years of experience in providing physical therapy in an occupational health setting, and is a member of the Workers' Compensation Research Institute's Texas Advisory Committee. At the conclusion of the presentation, we will have a 10 to 15 minute Q&A session with Dr. Cobb and Jim. You can submit your questions throughout the presentation to be answered during the Q&A. Dr. Cobb and Jim will answer as many questions as possible within the time allowed. A recording of the presentation and the webinar will be emailed to you after the presentation, so you can view it again at your convenience. Dr. Cobb, Jim, we're ready to begin.
Thank you very much. And thank you so much to our attendees. We appreciate your attention today. Just so that you know to whom which voice belongs, I am Janet Cobb.
And I'm Jim Waugh.
So thank you so much for joining us. Today, we're going to attempt a feat never accomplished before in the history of man, and that is we're going to try to make a discussion about an OSHA standard interesting. We'll not only talk about the proper way for you to meet and to be compliant with the record and the recording requirements, but also we hope to impress upon you the importance of trust, mutual understanding of the standard, and the need for open communication between you and your treating clinician. We know that ultimately you are responsible for acutely and accurately and truthfully completing your OSHA 300 log as the employer. We recognize, though, that our actions as clinicians play a vital role in whether or not you have to report an injury at all. We've heard before, we will definitely be taking questions at the end of the presentation.
So today, our agenda includes the definitions related to the OSHA standard, areas of recordability not covered in this presentation, the intent of the standard, who is covered by the standard, what does and does not constitute a recordable case, and finally, we'll finish with some resources and, as Dr. Cobb mentioned, a question and answer period.
So before we get started, let's just briefly discuss some definitions that you'll hear throughout this presentation. Of course, OSHA stands for the Occupational Safety and Health Act of 1970. The record-keeping requirements are maintained and are part of the 29 Code of Federal Register, Part 1904. The NAICS is the North American Industrial Classification System, which is a system that categorizes types of work. First aid and medical treatment, we'll talk in a little bit more detail about the difference between the two. Days away from work, which include time not at work. Restricted work and alternate work, and we'll go into a little bit more further detail throughout the presentation.
So let's look at the areas of recordability which are not covered in this presentation. There are specific case types, for example, those listed on the slide, that are addressed in the CFR 29 Part 1904, and each of those case types has unique triggers for reporting and unique tasks to outline to comply with the standard. In the talk today, we are going to address these case subtypes, but not going to address these case subtypes, but rather we are going to focus on the reporting as it relates to work-related injuries and exposures. If your particular workplace processes cases that fall into the categories listed on this slide, you can access more information from the OSHA website by using the links we have provided in the resource slide. We are also available offline to help answer any questions you might have regarding these cases.
Let's talk about the intent or the purpose of the standard. The ultimate intent of the recording standard, part of CFR 29, Part 1904, is focused on creating and maintaining a safe work environment. While it is true that during the course of accident investigation, one of the parties might be found to be at fault or an OSHA violation may be discovered, but that is not the sole intent of the standard. Similarly, employees who sustain injuries that may be reported on the OSHA log may be eligible for workers' compensation, but the two entities are not synonymous. The criteria to determine compensability under your respective state workers' compensation act must be different than the criteria for reporting, and we'll discuss that today.
So who's covered by the standard? And who must comply? In simple terms, for something to be considered work-related, there needs to be some type of event. There needs to be a specific thing that happens while the employee is doing work. This specific event then has to result in some type of change for the employee. For example, in most cases, pain that develops during the normal course of the employee's workday is not considered a work-related injury. If a worker who lifts boxes as their primary job task reports that nothing unusual happened on a Thursday, and then Friday morning they woke up with back pain, this does not meet the test criteria for an acute event. Therefore, it does not need to be recorded on the OSHA log. If that same employee reports that they picked up a 100-pound box with a coworker and reports that the coworker lost control of the box, causing this employee to twist his or her back while trying to keep the box from falling, this would constitute an acute event. Let's assume that same employee was known to have chronic low-grade back pain from arthritis. If the acute episode of twisting caused a change in the employee's baseline, for example, sudden worsening of pain or new pain radiating down the leg, then this would satisfy the criteria necessary to call this a recordable injury. Next, we're going to look at what does and what does not constitute a recordable case. So over the next couple slides, we're going to go through some examples of what would not be work-related. This employee is present at work in the work environment as a member of the general public rather than an employee. An example of this would be a Concentra employee on their scheduled day off comes to the center that they work at to have the doctor do a sports physical on her child. The employee falls off the stool in the patient room and hurts her back. This is unfortunate, but it's not work-related. Signs and symptoms surface at work, but result solely from a non-related event or exposure that occurs outside the work environment. An example of this would be an employee who is insulin-dependent diabetic is at work. The patient's blood sugar suddenly drops and the patient loses consciousness. The patient falls and cuts their forehead. This is unfortunate, but it's not a work-related injury. The injury or illness results solely from voluntary participation in a wellness program or a medical, fitness, or recreational activity such as a blood donation, physical exam, flu shot, or exercise class. Example of this would be the CEO of the company decides to set a good example for his employees by being the first one to get a flu shot. The nurse is set up to administer the shots in the employee break room. The CEO gets the shot, he starts to feel dizzy and passes out. He falls and breaks his wrist before someone can catch him. Again, this is unfortunate, but it's not work-related. The injury or illness is caused by a motor vehicle accident and occurs on company parking lot or company access road while the employee is commuting to work. An example of this would be an employee is on their last written warning for tardiness. The employee is late and rushing to work. The employee speeds into the parking lot, loses control, and his car crashes and hits a tree. This is unfortunate, but it's not work-related. The illness is the common cold or flu. For example, despite a strict company policy that recommends the employees stay at home if they have the flu, an employee who is still contagious comes to work to get some files so they can work on them at home. The next day, all the employees in the office come down sick with the flu. Again, this is unfortunate, but it's not work-related. The illness is a mental illness. Mental illnesses will not be considered work-related unless the employee voluntarily provides the employer with an opinion from a physician or other licensed healthcare professional with appropriate training and experience stating that the employee has a mental illness that is work-related. For example, an employee with a long-standing diagnosis of recurrent anxiety receives a personal call from his ex-wife. The employee proceeds to have a severe anxiety attack and EMS is called. Again, this is unfortunate, but it's not work-related. The injury or illness is solely a result of an employee doing personal tasks at the establishment outside of the employee's assigned work hours. An example of this would be an employee stays after hours making flyers to advertise his neighborhood yard sale. He waits until the other employees have left for the day because he wants to use his boss's color printer to print off 100 flyers. He rounds the desk, trips on an electrical cord, and falls and injures his knee. Again, this is unfortunate, but it also raises questions about this individual's ethics. The injury or illness is solely a result of a personal grooming, self-medication for non-work-related condition, or is intentionally self-inflicted. Example would be, for the last 3 years, an employee always seems to have a work injury the day before deer season. The employer has installed cameras in various locations around the facility. A video is recorded of the employee pouring water onto the floor and then laying down on the floor. The employee cries out in pain and the coworkers rush to his aid. This is not work-related, but it does raise questions about the person's character and morals. And finally, the injury or illness is solely the result of an employee eating, drinking, or prepping food or drink for personal consumption. The distinction here is that if the employee gets sick from food they brought from home, it is not work-related. However, if several employees get food poisoning from food supplied by an employer for a staff meeting, it would be work-related.
All right. Thank you, Jim. Those cases are real, and I've experienced all of those in my 26 years in occupational medicine as a physician. So now let's talk about cases that must be recorded if the injury or accident results in death, days away from work, restricted work or transfer to another job, medical treatment that's beyond first aid, or loss of consciousness or significant illness, those cases must be recorded. For the next several slides, we're going to explore in detail the criteria that you should be using to determine whether you need to record an injury on your OSHA log. So let's talk about probably the worst of all, and that would be death in the workplace. If an employee fatality results from a work-related incident, it must be recorded on the OSHA 300 log in the designated area. And it must be reported, so it's not just recorded, but reported to OSHA within 8 hours of the incident. Fortunately, in this day and age, fatalities in the workplace are rare, but they still occur. Even with some of the best intent and the best efforts to provide a safe workplace, they still occur. Let's look at days away from work. So one of the strategies for possibly keeping a case from needing to be reported or recorded is to have that patient or the employee go home for the rest of a shift, apply ice, and take over-the-counter medication. If these interventions are effective, the employee may be able to return to normal activity the next morning. Time away from work, the day of the injury, does not count and does not need to be reported as days away from work. However, if the medical clinician designates the employee should be away from work, it must be recorded, regardless of whether the employee returns to work. If the medical clinician returns the employee to work and the employee chooses to stay home, the days away from work do not need to be recorded. Now, years ago, weekend days were not counted as days away from work. Now, all calendar days are counted, regardless of whether the injured worker would have been scheduled to be at work on that day. For example, weekend days, holidays, they're all counted. And it's so important that the employer have great communication with the treating clinician to make sure that the clinician understands this concept. Otherwise, an injured employee may take advantage of the situation. Days away from work, the good thing is that they can be capped at 180 days. And you can stop counting the days the employee's away from work if they should leave the employment for reasons other than the injury or illness, such as they retire or they find a new job. Restricted work or transfer to another job. The same principle applies for time away from work on the day of the incident. It doesn't count. So if there's restricted work just for that particular day, it does not count. There are resources on the OSHA website, and we'll provide that link for you later, that can help you determine what constitutes a routine function for the job. OSHA considers this as activities that the individual regularly performs at least once a week. Technically, if the only trigger for the case to be recordable is that the clinician wrote a restriction and that restriction does not restrict a routine function, you do not have to record the case. An example would be if the clinician says, keep the wound dry, or if the clinician writes a restriction such as no lifting above shoulder for an individual that does not lift above the shoulder. And that is the only thing that's making it recordable. That wouldn't be considered a recordable injury if it wasn't an activity that the individual regularly performs at least once a week. Restricting the employee from working a full shift must be recorded. For example, if the clinician says this individual may return to work for 4 hours of their regular 8-hour shift, that is a recordable injury. Again, it's so important to have that conversation and communication with your treating clinicians, just so they're aware of what the actual regular duty is and the regular shift. Most OCMED clinicians will purposefully write general restrictions such as no lifting greater than 20 pounds. That is so that the employer can decide on the actual job or jobs that can be assigned to the injured worker. Now, if you receive a restriction that says patients should be on light duty, you're within your right to contact that clinician to ask for clarification. It's so important to partner with your chosen clinician. Communication is key. If the employee or the injured worker is observed performing their routine job functions with no apparent distress and they are still on restricted duty, communicate this to the clinician and send the injured worker back for reevaluation and hopefully discharge from care. Now let's look at medical treatment versus first aid. Many employers are very much aware of what this means, but I want to go into a little bit more detail about what constitutes first aid. So for lacerations, punctures, abrasions, and splinters, first aid would be steri-strips or butterfly bandages, application of over-the-counter ointment, treatment of infection with a non-prescription medication at non-prescription strength, removal of a foreign body with simple techniques such as tweezers or cotton swabs, removing bandages by soaking or even drilling a fingernail or toenail. That's called trepanation, to remove the pressure from under the nail. It's still considered first aid. Of course, using finger guards and non-rigid type of splints. As far as the eye goes, using only irrigation or a cotton swab to remove a foreign body is still first aid. Using eye patches is first aid. For fractures, well, any fracture is considered, it is automatically OSHA recordable. But just performing an x-ray to rule out a fracture is not considered medical treatment and still falls under first aid. using elastic bandages, wraps on sprains and strains, and using hot or cold compresses, and even using massage will keep it as first aid. Using hot and cold type of first aid measures is still non-recordable. And then for medications, as long as the medications are non-prescription at non-prescription strength, keeps it in the first aid category. Applying or administering a tetanus vaccination is first aid. However, administering other types of vaccinations, such as hepatitis B, would be medical treatment. Administering oxygen as purely precautionary measure and not as a treatment falls under first aid. Anything other than that is definitely considered medical treatment.
So let's look at musculoskeletal first aid versus recordable treatment. There's two columns on this slide. On the left, you'll see first aid. On the right, you'll see medical treatment. So some examples of first aid would be flexible taping, instrument-assisted soft tissue massage, a physical or occupational therapy evaluation, and or preventative exercise. So a physical or therapy evaluation is a thorough examination of the patient, which includes range of motion, strength, and functional testing. And remember, the evaluation in and of itself does not make the injury recordable. Preventive exercises that are considered first aid are exercises that are generally part of safe work practices commonly recommended for people engaged in certain activities or work with certain equipment that are not considered to be medical treatment. Common advice for persons driving long distances may include taking breaks to get out and stretch. Counseling or reminding an employee to engage in such activities or adopt such activities is not considered to be medical treatment. Again, for the purposes of OSHA record keeping, the focus is on whether an employee has sustained a work-related injury or illness and whether exercise is used to treat that condition. Versus reactive exercise, which is exercise that involves bodily movement prescribed to correct an impairment, improve musculoskeletal function, or maintain a state of well-being. Therapeutic exercise is considered medical treatment when it is designed and administered to combat a particular injury, illness, or disorder as part of the treatment plan.
Let's look at loss of consciousness. There's usually some type of controversy surrounding that. For any work injury or exposure that results in the employee becoming unconscious, it must be recorded. So as long as the loss of consciousness is secondary to a work-related cause, it must be recorded. But for conditions that cause the loss of consciousness that are not considered work-related, such as someone loses consciousness due to a seizure disorder or due to a cardiac event such as aortic stenosis, and it's not related to the actual work, that is not work-related. The length of time the patient is unconscious does not factor into the decision to record or not record. Let's look at also significant illnesses. So OSHA believes that cancer, chronic irreversible diseases, fractures of any type, of the toe, of the rib, etc., and punctured eardrums are generally considered significant injuries and illnesses and must be recorded at the initial diagnosis, even if there is no medical treatment rendered or work restrictions are not recommended, or if they're postponed in any particular case. So those are the significant illnesses. So TM, tympanic membrane or eardrum puncture, fractured rib or toe or fracture in general, cancer, irreversible diseases, and significant progressive diseases. They must be recorded. New case versus recurrence. These cases can be complicated and confusing as well. There's more detailed explanation and examples on the OSHA website. Definitely recommend that. In general, if the patient injures a body part, for example, the right knee, and this is the first time the employee hurt that body part, it is a new case. If they hurt the same body part in the past, but they fully recovered, and now they have a new acute mechanism of injury, it is a new case. There are exceptions listed on the website, such as recurrent exacerbations of industrial asthma. So this makes it a little bit more complicated. It would be nice to not have two recordable injuries of the same body part, but in the situation as I just explained, it would be. An example would be an employee hurts the right knee in February. The injury fully resolves by the end of March. The patient has no symptoms again until they slip and fall unrelated to the previous injury. They fall this time on water, and they hurt that right knee. It would be nice not to have a second recordable injury for the same body part, but unfortunately, per the standard, this would have to be addressed as a separate injury. Now, in the event that the second fall was a result of the previous injury, say a torn ligament, then that would not be a new case, and that would not need to be recorded as a separate injury or as a second injury. There are certain conditions and circumstances in which there's a time limit for reporting the injury, and that is for all companies, regardless of size or classification by the NAICS. If an accident or injury results in death, it must be reported within 8 hours of the event. For injuries or accidents that result in inpatient treatment, and again, the operative word is treatment versus observation, treatment or amputation or loss of eye, those accidents or injury must be reported within 24 hours of the event. And of course, they are recorded on the OSHA 300 log. Let's look at some privacy cases. So there's some exceptions and some idiosyncrasies of the standard that allow for an employee's identity to be protected if the injury or disease could result in social stigma. I'm hearing some background noise. This slide lists the most common examples for which you would keep the employee's identity off the log. Someone could mute their line. An example would be an injury to an intimate body part. We wouldn't need to record the individual's identity on the 300 log. In the case of sexual assault, that is work-related, that happens in the workplace, we could keep that individual's name separate from the actual log. In the case of HIV, hepatitis, or TB, or any type of disease that could result in social stigma, we're able to leave that individual's name off the log. Mental illness also falls under that same category.
Okay, so this slide represents an algorithm that can be used for deciding on whether to report or not report an injury. Let's look at the questions. The first one is, did the employee experience an injury or illness? Next would be, is the injury or illness work-related? Followed by, is the injury or illness a new case? And then finally, does the injury or illness meet the general recording criteria or the application to the specific cases? On the next slide, we're going to go through a real-life example of how of a case, and then we'll circle back to this algorithm to see how we would work through it. So, for example, a delivery driver slips on some ice on a resident's walkway. She twists her ankle slightly, but finishes her deliveries for the day. The next day, her ankle is still sore, so she goes to an occupational health clinic for reevaluation. The doctor determines that it is a minor sprain. She tells the driver that she will likely have a sore ankle for about a week, but that it should resolve on its own with no treatment. The doctor gives her a neoprene ankle sleeve and tells her to take over-the-counter Aleve for the inflammation. No restrictions were written, and the patient's ankle sprain is fully resolved within a week. So as we go back to the algorithm, let's walk through this specific case. Did the employee experience an injury or illness at work? Yes. Is the injury or illness work-related? The answer is yes. Is the injury or illness a new case? Again, the answer is yes. And does the injury or illness meet the general recording criteria? The answer here is no, and it is no because the patient did not receive any treatment. They only received first aid. So therefore, the case is not recordable. And again, remember, this algorithm is just a general guide to be used, and it's not a hard and steady rule.
There are some resources listed that will help you as you look into the recording requirements. There's the OSHA recording overview form, and this is actually a very helpful guide that provides information on the forms, how to complete the forms, and even submit the forms. There's the OSHA.gov website for the OSHA standard, and this is where the actual standard is located. I've reviewed this standard many times at this website, and it actually provides great examples and even different scenarios to help individuals determine how to report and record and what to report and record. It's a great one to have. There's the OSHA 800 hotline. That hotline is readily available for individuals who are reporting injuries, especially those injuries that must be reported within 8 hours, such as death, or those within 24 hours. It's great to have that OSHA hotline readily available. And then there's a tutorial website on how to perform the record keeping. They're all very valuable resources available to you. Please take advantage of those. We hope that there was something today that was of value to you and was able to provide some area of clarification around the OSHA standard for recording injuries. We're now open for questions.